While on a cruise holiday, a 66-year-old lady noticed a change to her fingernail, blaming it on a pedicure she had just had. She presents to you, however, 6 months later. Listen to a description of what happened. What concerns you most about her story?
How did it
It
look?
was like a point thing, and my nail started growing, and it was a bit bluey.
A little bit bluey, yes.
And then it's sent to go, and then it's come back again.
And you say it's been coming and going a little bit.
That bit there has.
Yeah.
What do you note on examination and on dermoscopy? How would you manage her? A fungal nail infection starts at the distal end of the nail, not the proximal nail area here. This in itself should tell you this is unlikely to be fungal in origin. The nail is a time machine, the tip of the nail being formed around 6 months previously. Note a small swelling on this adjacent nail suggesting a small myxoid cyst at the joint, often associated with osteoarthritis. These cysts can press on the nail, forming at the matrix, causing deformity or ridging of the nail. There's no obvious black melanin pigment visible, but 50% of subungual melanomas are amelanotic. In other words, they have no pigment. There's no obvious Hutchinson sign, where melanoma cells are invading the nail cuticle and into the nail. To me, this wasn't fungal, and the long history and nail dystrophy needed investigation. A wait-and-see policy for a dystrophic nail where a possible melanoma is in your differential diagnosis is unwise. I didn't take any nail clippings or scrapings as I felt this was an unnecessary delay. I decided a cancer care pathway 2-week wait referral was warranted just in case this was a melanoma. When she was seen in secondary care, they noted a few other myxoid cysts near other distal fingernail joints. An x-ray showed moderate osteoarthritic changes in her distal fingernails. They felt the arthritis and the cysts were deforming the nail matrix, causing these changes. No biopsy was taken, and she was discharged with advice that treating it would cause more problems than just filing her nails down as needed. Nail dystrophy originating at the proximal nail is a red flag sign and warrants secondary care referral in case of a melanoma. Would you have managed her differently?